Welcome to this edition of the First Aid Show. If you're unlucky enough to be bitten by an animal, there's not only the initial wound to deal with, but also the risk of infection and potential conditions such as cellulitis. Animals carry different bacteria in their mouths, and these can pose a more serious risk to both children and the elderly who have a weaker immune system. Dog bites may look worse simply because their teeth are larger, but cats, with their sharper, more pointed teeth, can penetrate deeply into the tissues. Cat bites are more likely to produce bacteria deep into the wound, causing a potentially serious infection and damage to tendons and ligaments. Cat bites and scratches pose different risks, and they can spread bacterial infections, and these are called cat scratch disease or CSDs. Symptoms of CSD generally occur 3 to 10 days after the bite or scratch was inflicted. The area may appear swollen, red, and might have a discharge pus oozing from it. It also might feel warm or be painful. An infected person can also have a headache, fever, poor appetite, and generally feel tired. Generally, CSD is not as serious, and in fact a medical treatment might not be required. As a first aider, initially ensure that the scene is safe and you're not going to get hurt by what's hurt the patient. Wash the wound area with soap and warm water or a first aid mild disinfectant solution. Dry the wound with the clean gauze from your first aid kit and then cover it with a sterile dressing. If the bite is large, deep, or the skin is torn, get professional help or call the EMS. Where the wound becomes swollen, painful, or the patient becomes unwell, seek a doctor as antibiotics or other treatments may be required. And if you suspect there's a risk of rabies, get the patient to a hospital as soon as possible. People often panic and assume that tetanus injections are needed. But actually, the risks of a tetanus from a bite from an animal are minimal, as the disease is mainly found in the soil, not in the mouths of animals. Where the wound is dirty and the patient is unsure if they've had a tetanus injection, advise them to see a doctor immediately. Finally, if you're dealing with a human bite, there can also be a small risk of transmission of infections such as hepatitis or HIV. But if you're in doubt, talk to a doctor.